And this joint in the big toe on the right side, is that bothering you at all?
Dr. Edward Dwyer knows gout when he sees it.
As I recall, last time you were here, you had some pain and swelling in this joint right here of the big toe.
And what's going on? I'm only 24. What's the type of pain? What is this pain that I'm having?
Gout is fundamentally a type of arthritis, but I would say of all the inflammatory arthritides, gout is probably the most painful.
It's something that you really have to experience to understand how immobilizing it can be.
Historically, and still most commonly, it presents initially as acute inflammation in the big toe.
Gout is caused by buildup of uric acid in the blood that then crystallizes within the joint cavity, usually in the feet first. The throbbing agony drives many patients to seek medical help. Doctors generally prescribe one of 3 different treatments for this type of searing pain.
One of the first ones that has been used is a medication called colchicine, which has been around for decades and is commonly used to treat acute attacks.
Doctors may also prescribe nonsteroidal anti-inflammatory drugs or corticosteroids.
About 75% of people will have another attack within 2 years. So the decision to be discussed with the patient is, do we just want to treat the acute attacks, or do you want to take a medication to reduce your level of uric acid such that you will no longer have any attacks? Now, obviously, you're committing someone to lifelong therapy at that point.
When I do have those attacks, do you recommend I put any ice packs on it? Or?
No, matter of fact, don't put ice packs on it. So the treatments that are currently available to reduce the level of uric acid in your body, the one that has been around for a very long time is allopurinol, which actually is an enzyme inhibitor that prevents the production of uric acid. Within the past few years, a second agent, febuxostat, has become available and works in the exact same way. And finally, a enzymatic protein that one can actually infuse into your body, which is called pegloticase. But the usual caveats in prescribing these types of medications is that when you initially give individuals a medication to reduce the uric acid, for about 3 to 6 months after the beginning of that therapy, it actually may be more common to have more gout attacks.
Another medicine doctors may prescribe is probenecid, which works by helping the body excrete uric acid more efficiently.
If you don't address the elevated uric acid, you'll eventually encounter the formation of what we refer to as tophi, which are actually physical uric acid precipitants that develop around joints under the skin and can be disfiguring, can cause a lot of issues with regard to skin breakdown, infections, and those sorts of things.
And now new research suggests that high uric acid in the blood may also be linked to an increased risk for developing diabetes and kidney disease. More reason to talk to your doctor about a treatment option that's right for you. For WebMD, I'm Damon Maharg.